I'm John Maloof. Today I'm talking with psychologist Emma Slade about acceptance and commitment therapy. Emma, tell us about yourself.
I work as a psychologist for a company called Weight Management Psychology in Brisbane.
And you're going to tell us today about a specific client and how you applied acceptance and commitment therapy, okay?
Yeah. So I've been working with a client, we'll call her Jen, and she's 18 years of age, and she first came to session. She was exercising, but struggling to exercise more, and she couldn't quite work out why.
Mm-hmm. And so what was the goal for her? What did she want to accomplish with you?
Yeah, so she came in and she spoke about going to a particular exercise class that she really loved, but she wanted to go 5 times a week, but finding she was going once or twice a week, and to her it just kind of didn't make sense as to, she really loved this exercise class, but she couldn't find the motivation, as she termed it, to go more.
Mm-hmm. And what acceptance and commitment therapy aspects did you apply to her?
Yeah, because Jen was shown that she really loved this class and there was this desire to go more, we spoke about acceptance and commitment therapy, or ACT, the ACT approach, and we really tapped into the values guided action. So this is the component of the ACT model that taps into commitment. So while she had the goal of going 5 times a week, we really assessed and looked at her values for going that often.
And you looked at her values, and you used some strategies. What strategies and with what effects?
Yeah, so I think a big point with any sort of client and with Jen was to point out the difference between goals and values. So using a really nice analogy of, quite often our values are the direction towards our goals, and our goals are kind of the end point. So for example, Jen had the goal of wanting to lose some weight and rectify some health concerns. When we looked at her values, that really gave her the why. So values that she picked out were things such as connection, fun, fitness, and industry. Industry is another word for being hardworking or dedication. So looking at those values, I then asked Jen, okay, when you go to your gym class twice a week, how in line are you with your values? Are you acting in accordance to your values? And she kind of looked at me and said, well, not really. You know, I'm not really working on my value of fitness if I'm going twice a week. I'm not really hitting my value of connection if I'm going once or twice a week. Then we worked on some visual cues. So she created some vision boards where she put them up in her room using these values. And that was that point of reflection where she could, if she was umming and ahhing about going to the gym, she could really ask herself, if I go, will I be hitting my values? If I don't go, will I not be hitting my values? In the ACT approach, it suggests that when we can act in accordance with our values, we then lead a rich and meaningful life, even if it's difficult in the moment.
Okay, and so in acting, going towards her values would be reinforcing in a way. She'd feel good about that, and that would help propel her forward in the future also.
Yeah.
Well, so what happened?
She came back at next session and she reported that she'd been to her gym class 3 times a week. So, you know, there's a slight increase, which was really great and really encouraging for her confidence as well. She did, however, discuss that sometimes she has competing demands. So she was at university, so a lot of university assignments, and she's also casually employed and often found that she'd be called into work at the last minute. And this seemed to be the point at which it would kind of upset her exercise routine. So she'd have all intentions, all plans to go, then be called into work. So it was a little bit of a discussion then and looking at her values in these other, what we call life domains, so particularly her employment. And what was interesting, again, one of her values for her employment was industry, so being hardworking. So we spoke a little bit about how sometimes to meet our values in one life domain, there needs to be a little bit of compromise in another life domain. You know, we're only one person, we can only do so much. She then went away, contemplated, reflected on that. At the following session she came back, she'd been to 4 exercise classes, but she discussed feeling a lot more at ease about, you know, the days when I can't make the gym because I'm hitting my values in the life domain of work. Yeah, so we're seeing this gradual increase in her activity levels or her gym attendance, but we're also seeing her, and what's called in the ACT approach, dropping the struggle with almost the stress of not going to the gym, which we know in turn then increases the likelihood of, motivating behaviour in the future. It's not this, I really should go because I haven't been all week. It's, I want to go because I'm going to hit my values, but if I'm hitting my values in my other life domains, that's okay as well.
Right, so she felt satisfied in achieving what she could achieve, and she accepted herself and limitations. If she can't achieve everything in one domain, she's still achieving something.
Absolutely.
And so that was the short-term effect. How, longer term, what's happened?
So longer term, she's been able to maintain that 3 to 4 sessions per week. So again, she's not quite hitting her goal of 5 times a week, but again, we'll do a little bit of work around whether that's realistic for her. Again, looking at her, not just in her exercise domain, but across all areas of life. We've also did a little bit of work in how Jen can hit her values in exercise through other forms of movement. So Jen spoke about really loving going for an early morning walk by herself as a bit of self-care. So what's great is now that she's been working quite big hours, and again we know that can be a barrier for her to going to the exercise classes, but she's walking a lot more. So she's walking anywhere between 4 to 5 times per week. So again, we're really, dropping this struggle that I must go to these gym classes and kind of racking her brain, why can't I go if I love it? What's the struggle here? So really dropping the struggle with that. Sometimes she's going to work, but more often than not she's walking, which she's really enjoying. It's really great to see as well that she's now herself gone and applied the values work in regards to healthy eating. So she's done this all by herself, which is excellent for a client to do. She's gone home, she's looked at her values for healthy eating, and now when she's preparing meals or she's doing a grocery shop, she really taps into the values in regards to healthy eating.
Well, it sounds like a big success that she changed her behavior, she improved her behavior. Her emotions developed in a positive direction also, and in a way the ultimate outcome for a client, she generalized what she had learned over to a different class of behavior, which is eating. So it's eating in addition to exercise. So you would count it as a big success.
Yeah, and that's what I really loved about the ACT approach is, again, quite often you'll have clients coming in who will be like, this is my goal. But sometimes when we kind of broaden back out, again, looking at their whole life, we might not be hitting the goals per se, but they get, again, as the ACT approach suggests, a lot more meaningful experience across all aspects of life.
All right, well, very good. Nice example of application of acceptance and commitment therapy. Thank you.